Hi folks, Dr. Hartl here. Today we're going to talk about care of the 4-month-old baby. Feeding wise, your baby should still be exclusively breastfed or formula fed at this point. You can start to think about introducing solid foods, but you don't have to until they're 6 months or so it's up to you. If you are interested, make sure that your baby seems ready, so they seem interested in food, and are they able to hold their head up independently. If they can do those things, then you can start some solid foods. Generally, people start with rice cereal or oatmeal or pureed fruits and veggies, and when you first introduce it to your baby, they're going to choke on it probably. It's going to go down the wrong tube, but as long as they can cough it back up, they should be fine. At this age, you're mostly just teaching them how to chew. Most of their calories should still be coming from breast milk or from formula. There are a couple safety things to know about before starting solid foods. So the first is we don't recommend rice cereal more than 3 or 4 times a week. There is some concern for increasing amounts of arsenic in rice cereal, and so the AAP recommends no more than 3 or 4 times a week. The second is no raw honey until they're at least a year, and the reason for that is that raw honey can contain botulism spores, and babies' intestines are porous, and so those botulism spores can actually get into the systemic circulation and cause systemic botulism in babies, which is a horrible illness. Adult intestines are less porous, and so we just send them right through and poop them out, but babies don't do that. The other safety thing, and this is for when they're a little bit older, usually isn't a problem at this age, but watch out for choke foods. So anything small and round that can get down the wrong pipe and not come back up, so things like nuts and grapes and pieces of hot dog, anything small and round, you got to be careful with. Your baby should still be on their back in a crib or bassinet without anything else in the crib or bassinet with them. This is the highest risk age for sudden infant death syndrome, SIDS, so it's important to keep those things in mind. You can start to think about sleep training your child at this age. They're starting to develop a more normal circadian rhythm, but we generally don't expect kids to sleep through the night until about 6 months of age. All human beings sleep the same way. So after falling asleep, you cycle down into the deepest state of sleep, and then you cycle back up to shallower states of sleep and back and forth throughout the night. The deepest state of sleep is called REM, rapid eye movement sleep, and you need about 7 or 8 cycles of that to feel well rested in a night. Children usually need more cycles, 8 to 10 cycles in a night. In the middle of the night, you actually wake up and check your environment. And if everything is not exactly the same as how you're accustomed to falling asleep, it makes it much more difficult to cycle back down to the deeper states of sleep. Parents get into trouble when their child is accustomed to falling asleep with something and then doesn't have that again when they wake up in the middle of the night. Usually it's things like bottles, cuddling, or TV or radios, or even falling asleep in a different place and then being placed in the crib. Then the child wakes up in the middle of the night and they don't have any of those things, or their environment has shifted, and it's much more difficult for them to cycle back down to REM sleep, and that's why they wake up and fuss. So sleep training is just training your child to fall asleep in the environment that they're going to wake up in the middle of the night. Now, when you first start doing this, your child is not going to like it very much. And there's really only 2 ways of doing it. You can let them cry it out, which is the faster method, but it's also a little more excruciating for parents. Or you can do something called graduated extinction, where you go back in and comfort your child, but at greater intervals throughout the night. If you'd like more details, see the video linked with this video about sleep training. Continue to read to your child every night. I know it sounds strange, but they are absorbing lots of words at this stage. Continue doing tummy time, usually 2 or 3 times a day for 5 to 10 minutes or more if you'd like to do it. And start to get into routines with your kid. So get into nap time routines and feeding routines. Routines become much more important later on, so the earlier you establish them, the better off you're going to be later. So a couple of safety things to reiterate. Your child should still be in a rear-facing car seat, and that's going to be true until they are older than 2 years old. 4-month-olds generally start to develop the ability to roll pretty soon, so it's really important not to leave them anywhere high off the ground, beds or countertops or changing tables or anything unsupervised, because they can roll right off. We recommend that your water heater is set to less than 120 degrees Fahrenheit, and that you be very, very careful with hot liquids around your kids, tea, coffee, that type of stuff to prevent burns. Speaking of liquids, do not leave your child unattended in any amount of liquid for any amount of time. So sinks, bathtubs, that type of stuff. Car accidents and drowning are the things that kill kids in this age group, so that's why we recommend it. The other thing to be aware of is we recommend against using walkers. Walkers can be dangerous, especially around stairs, and they also tend to delay the onset of walking in kids, so we just don't recommend them. Fever is no longer an emergency in your child, but we do recommend that you talk to your provider about what symptoms your child is having, just to make sure that there's no red flags for anything dangerous going on. If you'd like to treat your child's fever, we only recommend Tylenol at this age. We don't recommend Motrin until they're at least 6 months old. Vaccines and breastfeeding are the best protection for your child, and if you have any questions about either of those things, you can see the links that are provided with the video.